University of Arizona, and happy to be co-hosting this event with you, Paul.
Thank you. If we go to the next slide, please, here, as folks are joining in, do have some of the meeting housekeeping. As you just saw, the first part of the webinar is going to be recorded. We are asking again that you make sure that you are muted, just like every other webinar that you attend, and to keep your cameras off. We are going to be trying to capture questions that are in the chat box. There's going to be a lot of people on here, and our time is pretty tight today, so we may not get to many, if any, questions, at least during some of the early presentations. There are the breakout sessions later on, which are going to be more interactive, and we will likely be able to circle back on any questions that you ask, because as you see towards the bottom, presentation slides will be made available and distributed after the meeting. On the next slide, you see all the steering committee. There's quite a few folks here that helped participate to help put this together, from ADHS, from NOAA, from U of A, and ASU. So a lot of back end work that has gone into this. On our next slide here, you can see a little bit of a breakdown on who has registered for our meeting. We did have over 350 people register for the meeting, which is our highest. Again, with the 6th annual one, we've been growing participation in this over the years, but now 350 is quite a jump even from last year when we had 250. So thank you all for participating. You can see on the word cloud also from where folks are attending. We are branching more and more out from Phoenix, which is fantastic to see. A lot of folks from Tucson joining us today as well in other parts of the state. On the next slide, we'll jump into the agenda a little bit, and I'll pass this to Lad and allow him to go over this a little bit more.
Great, thanks, Paul. Like Paul mentioned, we won't have time for questions and answers with the first couple of presentations, but we're excited to have Julie Tertan with us from NOAA. Then we'll go into Paul's weather and climate trends outlook for the state. We have Laura Fox with Arizona Department of Health Services giving us some heat health updates. And then we have a highlight on heat and homelessness with 2 speakers from both Phoenix and the Tucson region. We'll take a short break. Then we have Melissa Guardaro with financial tools for heat management. And then we have a chance for audience engagement with some breakout discussions that we'll describe later on. But again, we'll have questions and answers certainly for the heat and homelessness panel. And then for the breakout discussions, we'll have some engagement as well. Yeah, great. So with that, I'd like to introduce Julie Tertan, and we're really honored to have her here today. So I'll just give everyone a little bit of her bio. So Julie is the One Health and Integrated Climate and Weather Extremes Research Lead for NOAA. She's responsible for developing and implementing the NOAA health strategy across NOAA and other federal, state, and local international agencies, academic and private sector partners. And she's leading efforts to build the United States National Integrated Heat Health Information System, or NIHIS, in partnership with agencies such as CDC, FEMA, OSHA, NIOSH, EPA, and many others. She's one of the 3 co-chairs for the newly established White House Extreme Heat Working Group. And in addition to many of her other federal accomplishments and international accomplishments, she's also authored many book chapters and articles, and was an author for the 4th National Climate Assessment, served on the steering committee for the USGCRP Climate and Health Assessment, and was a convening lead author for the water-related illness chapter. And she's also honored to be part of many scientists who won the Nobel Prize, Peace Prize for her climate change work. So with that, Julie, I'll turn it over to you. And again, thank you so much for joining us this morning.
Oh, thank you, Lad. And thank you for the kind introductions. I didn't actually mean for you to read all of that. So, but it's really, I'm so thrilled to be here. I had a chance to hop on with the steering committee a little bit before this and, over the course of the last few months. And I just want to thank you all for inviting us to be here. I know NOAA is already at the table. NIHIS is a little bit different in terms of an interagency construct, but it's really such an honor to be a part of a meeting that's, full of people who are actually really, managing heat risk at the state and local level. So as Lad said, I am with NOAA. I lead the National Integrated Heat Health Information System along with Paul Schramm, my colleague from the Centers for Disease Control, and Kim McMahon, who is my colleague from the Weather Service. You also, probably many of you know Hunter Jones from the Urban Heat Island work, and we have a new person on our team. If you haven't heard from her yet, I'm sure you will. Morgan Zabal, we are really thrilled to have her, and she is planning NIHIS National, which I'll talk about in just a minute. So if you don't know her yet, you will soon. So I feel like my job today is to just actually am looking forward to listening to all of you, and especially the heat and homelessness. But I'm going to just speak to this slide. And if you're from NOAA, you might be rolling your eyes because we use this all the time. It's like NOAA's job is to do a seamless suite of forecast products across timescales. But when it comes to heat, it really is quite true. And part of the reason, which I'll get to in just a second, but the reason we created this National Integrated Heat Health Information System was to do a better job of coordinating all the pieces that were already happening on heat. So in some areas, there's not enough happening, and in heat, there was a lot going on, but at different time scales, and sort of people weren't talking, and we weren't quite sure what products to produce when, and so there was just a disconnect, and also a real big need to address the planning across the multiple timescales. So what do you do? So Lad, to your point about planning and urban design and zoning boards and transportation, and just sort of bringing all the communities together so we can do a better job from, managing the heat wave that is imminent to reducing heat, illness, and death in the long run. And if you add on top of that, which you all know all too well, drought and wildfires and, compound and cascading hazards are a huge problem. So really it's how can we best understand the decisions that you're facing, the information you need to help enhance decisions, streamline them, and in the end, just reduce the heat-related illness and death. I mean, that's the goal. They're preventable. We all know that. So how do we help you do that? How can we learn from you? How can you learn from us? And what should we be doing on the federal level to support you all? So you can see this time scale issue here and the planning. You're covering a lot of that in the call today. So it's really exciting to see these meetings happening. I understand from other states that you guys have seeded some other states doing similar kind of extreme heat planning calls. So it's pretty cool. So this is a little bit about NIHIS, and just in case you are unaware, it is called the National Integrated Heat Health Information System. And we did design it really to address heat across timescales and across agencies. But honestly, it was because there were gaps in the science and gaps in the implementation. NOAA and CDC launched it, but we have several agency partners and a really strong interagency network. It is public-private partnership as well. But you'll see down at that bottom slide there, it's an interagency piece. There are pilots, of which the Urban Heat Island, I'll show just one slide in a second, is like the biggest pilot. I think most of you are aware of that. We do have this partner network, which is designed to be the space where non-feds where we can actually come together. And that's what we're really hoping to build out through interactions like this and through the administration priorities of this next few years. So we do have international work with our Global Heat Health Information Networks group, and some of you know that. And then a pretty strong communications and outreach effort, which we're hoping to embellish further the next year or two. I'm just going to go on into a little bit about some highlights, because I think the main point about NIHIS is that I really wanted to stress the partnership piece. And we have in this administration, this administration established a new extreme heat working group. NIHIS was, however, established under a White House National Security Council working group in 2015. So we've been around for a while, and so we are actually kind of the backbone helping support many of the activities of this new White House working group. And I think that should signify to all of you and the rest of the country that this is a priority for the administration. Heat, certainly NIHIS is actually, in fact, the Urban Heat Islands specifically are part of the Justice 40 initiative. So really trying to get at the environmental justice issues square on. The homelessness topic that you all are covering is really one that we're talking with our Veterans Administration about, and trying to figure out how to do some work on specifically homeless and other disproportionately affected populations. So these are the things that we're going to be discussing at the NIHIS National meeting, which starts tomorrow. It's our first NIHIS National. It's Tuesday, Wednesday, Thursday. You can see the website. If you haven't registered, please do so. We are really, really happy to have the opportunity to have federal, state, and local practitioners. In fact, Lad is leading a session. David, we've got a lot of you are actually in the meeting tomorrow and the next few days. We also have some very senior agency leaderships, the head of NOAA, the head of CDC, Assistant Secretary of State, the Climate Office at the White House, OSHA, EPA, FEMA. They're all speaking. And so I hope you can see kind of that this administration is really interested in the issue. So if you're not signed up, please go ahead. Next slide, please. And I'm hoping that you'll take your knowledge and what you need us to hear to this. And I'm going to show you a few opportunities to engage and just say that we hope that next time around we're planning this NIHIS National with our state and local partners. This year it was a challenge just to get the federal interagency rebooted in this new administration with all the enthusiasm. So that's been a great fun thing to do. Next time we hope we have greater partnerships with you in planning the meeting. But you'll see on the agenda the obvious things, but note please the networking sessions on day 1 and 2. There are opportunities there and they're intentionally designed to be able to find out what's going on at the state and local level on various thematic areas like homelessness or maternal and child health or urban and rural heat and various topic areas. That's day 1. Day 2 is some of the networks like the ASTO and NACHO, Association for State and Territorial Health Officials, and National Association for City and County Health Officials, and the Group on Earth Observations Health Group. So we just really wanted to create that opportunity for you all to talk to each other. And then on the morning of day 2 and the morning of day 3, there's a coffee hour, one on indicators and one on international. So those are around the margins to try and create some conversation space. Next slide, please. And I'm about done. I just want to mention this one last piece, which it should be relevant. I wouldn't put this up everywhere. We are actually following on some of the climate and equity roundtables that we NOAA did in region earlier this fall or last fall, and doing some climate and equity resilience pilots based on what we heard from you through those roundtables. So you should have already gotten notification of 2 webinars we've had to sort of discuss it, embed it, and there will be some more work coming on those areas. So excited, especially since one of them is in Arizona. Oh, yeah, I guess this is important. We are doing a strategic plan. First time we will have had a heat strategic plan, because heat does not fall in any agency's mission or mandate. Nobody has a NIHIS budget or anything like that. So we are really happy at NIHIS National to have Senator Markey, who's introduced some legislation. Congressman Chris couldn't make it, but there's House and Senate has legislation introduced. We're doing a strategic plan to try and integrate this into the agency. So we're looking at a pretty active year. And I just wanted to leave you with some links. You can find the NIHIS registration. You can find some pretty cool tools. You can find out about the urban heat island campaigns, and you can find out, we'll be making some pretty cool announcements about them. Dr. Spinrad will tomorrow morning. So, log into NIHIS just to hear about that. And with that, I will turn it back over to you all and just say again, with extreme gratitude, thank you for the opportunity to be here. And I'm so excited to hear what you all are talking about today. And know that the door is definitely open and it's a two-way street, and we're looking forward to even closer collaborations. We've already got the weather service and really on the ground. So we just want to build on that. And I hope you have a great rest of your meeting. Thank you, Lad, and thank you to the steering committee for the opportunity here.
Great, thank you so much, Julie. And I do encourage everyone to check out the NIHIS National meeting coming up. Even if you register and you can't attend, there will be recordings and other opportunities to participate in that. And I really do like this setup that we have, where we have a state workshop kind of followed by the national one, so people can do their important local work and then kind of zoom out to the national picture and see what's going on in other places too. So thank you, Julie. With that, I will turn it back over to Paul Iniguez. And I believe it's tradition at this point, right, Paul, to make a joke about this is the point where you tell us how hot it was last year and how hot it will be coming up this summer, right?
Unfortunately, the trends continue that way, yes, and will continue for the foreseeable future. So thank you, Julie, yes, for your opening remarks. Good morning again, everyone. Here I'm going to give a little bit of the update on the weather and climate trends from the Arizona perspective. If you go to the next slide, please, we'll just kind of start out on a broad perspective and look at the trends for the entire country. These are looking at the average temperature May through October, the warm half of the year, if you will, across the US. You can see in the little map, just the thing to note is that there's a lot of red on the map. Unless you are living in South Dakota, there's actually a very, very small downward trend. But unfortunately, we live in a part of the country where it is quite red. And you can see that for the country as a whole, the average temperatures are warming 0.4 degrees per decade. On the next slide, we zoom in a little bit more on the Southwest. You can see that the trend has increased a little bit. Here we're at 0.6 degrees per decade, warming all locations. And then finally on the next slide for Arizona, you can see that that trend continues 0.6 degrees across the entire state per decade. but some pockets of the state, warming a little bit faster than other parts as well. So, climate change has been happening very steadily in our part of the world, and it's projected to continue that way, unfortunately, for many decades. On the next slide, just taking a little step and see where the temperatures for Arizona, again, this warm season last year, it was actually the 8th warmest on record. So it was a nice decrease from 2020, which was our worst, hottest year on record by far. But you can see that even we're still the 8th warmest. So one thing that I want to point out is that we did have a lot of rain in parts of the state last summer with monsoon. It was our 15th wettest on record. And so even, normally when you get all the clouds and the precipitation, that really depresses your temperatures. But even still, we only managed to go down to the 8th warmest. So it's interesting that the warming signal is so strong that it's kind of overcoming some of the other mechanics that are going on. If you go to the next slide, you'll see this kind of breakdown of the month by month, and the shading are the percentile. So the cooler ones are the lower percentile, of course, and then the warmer colors into the black are the higher end percentiles. So you can see that we kind of started our heat season warm. April and May were pretty warm as a whole. It was 89th percentile in April, 80th in May. And then June came along. It was the hottest June on record for the state. You can see many areas had their hottest on record, those black areas. And then we got into the monsoon in July, and we actually, again, got pretty good precipitation. You can see parts of southern Arizona were actually into some of those lower percentiles, which is a nice change. But northern Arizona really didn't get into any of that cooling. As you can see, July, August, September, the northern half of the state pretty much stayed in those upper percentiles the entire time. So the precipitation didn't really help out all of the state in that aspect. And then we went into a relatively cool October, but then heat came back in November, and then it's been warm in December, and kind of this La Nina pattern we've been in since. On the next slide, you can kind of see some of these extreme temperatures and how we deviated. So on the left side, this is the departure from an average, a 30-year average, the number of 90-degree days. In the middle is the 100-degree days. So you can see that the southern part of the state did have fewer 90-degree days and fewer 100-degree days than usual, but the northern part of the state was actually a little bit above average, again, reflecting that kind of missing out on some of that rainfall during the summertime. And the far right map for not every part of the state, of course, sees 110 degrees, but parts of the state did see a couple fewer, but the far western part of the state actually saw a couple extra of those very high end days. On the next slide, it just kind of breaks that down, at least these 100-degree days for Phoenix itself, and looking at the cumulative numbers. The black line is the average for the previous 30 years, and then the red line is what 2021 had. So we actually came in slightly below average, and it was far less than we saw, excuse me, in the previous year, but still quite high. And on the next slide, we see how that kind of fits into these long-term trends. I know some folks have seen this chart. I did manage to get this updated with our 2021 plot in there, quite a bit below that record again at 145, but this long-term trend is projected to continue well for the next several decades. On the next slide, we can jump into where we see our heat warnings that were issued last year, comparing 2020 on the left side versus 2021 on the right side. Generally, a third to half as many excessive heat warnings were issued across the state, reflective of those somewhat cooler temperatures during the summertime, but still a lot of impactful temperatures. On the next slide, it kind of breaks it down, just looking at Phoenix specifically when those happened. So not a big surprise, we had a big, very hot streak in the middle of June. So Phoenix was under heat warning at that point, and then some sporadic periods through the subsequent months. So those 20 days of heat warnings was pretty typical for the preceding 10 years. So pretty much on average as far as number of heat warnings there. And then I did throw the little heat risk strip at the bottom for Phoenix. And I'll dive more into this if you come to our breakout section for the Weather Service, but it's showing what the observed heat risk was for Phoenix. So we generally, again, issue our excessive heat warnings when we're at the higher, very high colors, so those red or those magentas. Next slide just shows you a quick little overview of where you can get that heat risk. So really good information there, and maybe Dave can pop the link in the chat. Again, this is taking our high and low temperatures and put it into a climatological context and trying to assess the risk level for the heat. And again, we're using those for generally our high and very high is when we're going to hit those excessive heat warnings. If you go to the next slide, we start looking at what do we have coming up. And so this is the just released outlook. This was updated on Thursday, and this is showing the outlook for June, July, August, so our 3 hottest months. And this is giving you the probability of the temperature, the average temperature during that 3-month period landing in the upper, middle, or lower part of the climate distribution. So you can see a lot of warm contours on here. So there's a lot more chips being put on the high above normal category. And I did a little breakout here for a couple of the pie charts for some different locations. And you can see that for northern Arizona, there's a better than 50% chance of landing in the above normal category. And if you go down to southern Arizona, it's a little bit below 50%. But you know, the big thing that's going to kind of play into this is how is the precipitation monsoon activity going to play in. If you look at the next slide, there is actually a very modest chance of a wet or active start to the monsoon possible. So it's about a 35 to 40% chance depending on where you are. So we are seeing some signals that we could get a good jump on precipitation this summer, and we'll see how that plays into the temperatures, because as I showed in some of the earlier slides is that if we have a lot of that clouds and precipitation, it's not a big surprise, can help hold down our temperatures. But something that we always have to consider is that the long-term trends or the climate change trend signal is so strong, it can tend to wash out or override that a bit. So, you know, needless to say, it's still going to be very hot, and we're still going to have impacts that happen this summer. On the next slide, just to kind of wrap it up, I'm so used to giving these weather updates quickly during our bi-weekly calls. Temperatures moderated in 2021. Again, that was partly active to the due to the active monsoon, but you know, we're still going to have hot temperatures this summer. We live in a hot climate. There's always going to be impacts, so we have to always be prepared to handle that. If you want deeper dive on some of the tools and how you can get access to real-time updating information, please attend one of our breakout sessions. I'll be walking through essentially how you can get information starting at as far as a year out, looking at these climate outlooks that, like I shared, those are available up to a year in advance. And we'll walk all the way up to the day of the event is happening, a heat event is happening. So I'll be showing you all these specific places that you can be obtaining that information. The Weather Service offices are always here to partner with you and provide you with weather information. I have this little map of Arizona here. And if you jump to the next slide, this will actually show contacts for each office. So each weather office in a different color here. In northern Arizona, it's covered by the Flagstaff office. We have these contacts are called the Warning Coordination Meteorologists. So they're excellent folks to reach out to for additional help and information. Tony Merriman works at the Flagstaff office. Mojave County in northwest part of Arizona, covered by the Las Vegas office. You can reach out to Dan Burke there. In southeast Arizona, in that blue area, that is covered by the Tucson National Weather Service office. You can reach out to Ken Drusd, and then the pink area is my office, so you can reach out to me, or you can reach out to my colleague, Tom Frieders. And with that, I will be wrapping up the weather portion. So the next slide will get us to bringing in Laura Fox from ADHS. So Laura will be giving updates on their information and their data. So take it away, Laura.
Yeah. So hello, I'm Laura Fox, and I'm an epidemiologist with the Arizona Department of Health Services Environmental Public Health Tracking Program. I support the heat illness surveillance and epidemiology work conducted here at ADHS. Today, I plan to provide an update on the heat-related illness and deaths in Arizona from 2021 and health department initiatives for heat resilience. To jump into the heat data, first is the 2021 preliminary heat-related death summary for Arizona. And data for this summary originates from the state vital event registration system or death certificate information for all events that occur in Arizona. So all deaths that occur in Arizona here. In 2021, there were 551 heat-related deaths recorded preliminarily. This is an increase from last year's historic record of 522 heat-related deaths in the state. In 2021, there were 7 deaths associated with COVID-19, and that's the same number as in 2020. Heat deaths in 2021 were mostly seen in males. 64% were white non-Hispanic, 27% Hispanic, and 34% were middle-aged adults 45 to 64 years old. This is consistent with prior years of data. About 42% of heat deaths were associated with substance use, and about 60% of heat deaths occurred outdoors. Looking into the number of heat deaths recorded in Arizona over time from 2009 through 2021, there continues to be an increasing trend statewide. There's been a 400% increase in heat deaths from the lowest point recorded in this graph in 2014 with 91 heat-related deaths to 551 heat deaths in 2021. The biggest increase in heat deaths occurred from the 2019 to 2020, where there was almost a doubling in the number of heat deaths statewide. Looking at the percentage of heat-related deaths by county in 2021, most deaths occurred in Maricopa, Mojave, Pima, Yuma, and Pinal counties, and this follows the same pattern we have seen in prior years. Looking at substance use as a contributing factor in heat deaths, about 30% of heat-related deaths were associated with drug use, indicated by the red line in this graph. From 2020 to 2021, there was a slight decrease in drug use among heat deaths after following that increasing trend from 2015 through 2020. Next slide, please. Reviewing injury fields recorded in the death records, about 60% of heat-related deaths occurred outdoors in 2021, and this is consistent with data from 2019 and 2020. Transitioning to heat-related illness emergency department visits and hospitalizations, data comes from the Arizona Hospital Discharge dataset. This data was just released on Friday for 2021 for the full year, so full results and analysis are just not available yet. But on the next slide, I was able to prepare an initial look into the data. So shown here is the number of heat-related illness emergency departments visits in red and hospitalizations in blue from 2008 through 2021. There were 2,873 emergency department visits and 920 hospitalizations recorded in 2021. Both ED visits and hospitalizations increased in 2021. In 2020, you can see there was a decrease in ED visits, but the number has rebounded to at or near the number of visits recorded in years prior to 2020. Next slide, please. To provide a brief overview of the population demographics of both heat-related ED visits and hospitalizations, summarized here is the 5-year averages from 2016 to 2020. So for heat-related ED visits, there's an average of 2,800 ED visits per year. Majority are male, young adults 20 to 44 years old, and white non-Hispanic. And for hospitalizations, there are about 750 heat-related illness hospitalizations on average, and majority are male, slightly older than the ED visit population, with middle-aged adults 45 to 64 years old, and white non-Hispanic. Both groups experience comorbidities such as mental health and or circulatory diseases, and with a higher percentage identified in the hospitalized group, and substance use is also a contributing factor in both the ED visit and hospitalization groups, with a higher percentage identified in the hospitalized group. Next slide, please. I wanted to share where some historical heat-related data is stored at ADHS. Here displayed is the Arizona Data Explorer for the Environmental Public Health Tracking Program with the URL right there. Data is available from 2005 through 2020 for heat-related ED visits and hospitalizations, and also mortality data. Data is available by month, age group, gender, and year for counts, rates, and age-adjusted rates at county and sub-county geographies. And data can be viewed in maps, charts, and tables and are available for download. Next slide, please. Additionally, more detailed historic data is available in our heat-related illness, ED visit, and hospitalization surveillance reports available on the ADHS heat safety page. ED visit and hospitalization report describes data by demographic factors and others such as comorbidities, substance use, place of injury, and preceding activity. Transitioning to health department initiatives for heat resilience, ADHS was awarded another 5-year grant through the CDC BRACE program. BRACE stands for Building Resilience Against Climate Effects for 2021 through 2026. And work under this grant will update the statewide Arizona Climate and Health Adaptation Plan and support counties to update their climate and health strategic plans and conduct cooling center evaluation studies in Maricopa and Pima counties. Last spring, ADHS Climate and Health Program published the School Heat Policy Guidance Document Pilot, which describes strategies to develop a school heat policy. And included in the guidance is prevention strategies based on climate, region, and the state through a tiered response approach, and outlines key elements of a heat policy. You can join the School Heat Policy breakout session led by Carmen Turdea and Mary Munoz Encina to learn more about this later this morning. We continue to send out email and text message heat alerts with public health messaging each heat season. For several years, ADHS has sent out National Weather Service heat warning messaging to email listservs. And currently we have about 22,000 Arizonans signed up to receive these alerts, partnered with public health safety tips. And additionally, we have a separate heat alert set up for the school community that offers tailored messaging to protect students and staff during heat warnings. And this list continues to grow, and we currently have 6,000 subscribers to date. You can sign up at azdhs.gov/heat to subscribe. Our program, in conjunction with the National Weather Service, will observe Heat Awareness Week, May 23rd through May 27th this year. We plan to share heat safety tips and prevention messaging through social media, newsletters, and on our website. And in the coming months, we plan to update the EPH Data Explorer and heat-related illness surveillance reports with 2021 heat data. And additionally, we plan to finalize the school heat policy guidance document available at this website below. And that concludes my presentation. So thank you for your time, and my contact information and key websites for more information can be found at azdhs.gov/EPHT or /heat.
Great, thank you so much, Lauren. We're actually doing really well on time. So I believe we have 2 questions. If you're comfortable, we could float those to you to answer. And before I get those questions, just a reminder to everyone, I know there's been a lot of information from both Paul and Laura. All of this information in the slides will be available on the Arizona Department of Health Services website. And I believe Carmen put the link in the chat. We'll also email that out to all of the participants too. So don't feel like you have to furiously take notes on every single fact. I know there's a lot of information kind of coming out. For the questions, Laura, one of them is, do the death numbers that you were going over for heat-related deaths include migrant deaths along the border?
I think any death that occurs in the state of Arizona boundaries is included in this data.
Great. And a kind of related question that I think we still have time to answer is, are you able to identify how many of those deaths are work-related or happen on the job site?
We can identify for the ED visits and hospitalizations through billing codes, specifically workers' compensation insurance used for the visit or charged for the visit. We have not prepared or shared that data to date yet, but it is available and is something we are looking at to incorporate into our surveillance reports as well.
Okay, great. Thank you so much. The 2 speakers that we have coming up to speak about heat and homelessness. So just to frame this a little bit before I introduce both Amy and Cliff, obviously, it's well documented that heat impacts are often the greatest for those without reliable access to quality housing and indoor cooling, such as those experiencing homelessness. And it's a very diverse group though, so it can include young adults on their own, families, veterans, people experiencing chronic homelessness. According to the latest point-in-time count overseen by HUD, the number of people experiencing homelessness in Maricopa County increased 33% to over 5,000 from 2020 to January 2022. These numbers are, of course, likely vastly undercounted, and many other communities across Arizona have not been able to conduct their point-in-time counts in recent years due to COVID-19. And of course, although many factors contribute to homelessness, and our panelists will discuss those, The shortage of affordable housing is certainly an increasing nationwide problem that's not helping. And currently, no state has an adequate supply of affordable housing in the United States, according to the latest National Low Income Housing Coalition report. But kind of striking for us in Arizona, Arizona's shortage ranks the third most severe in the nation, following only California and Nevada. And our state needs 143,000 more rental units for extremely low income people or those with incomes below the poverty line to cover that gap. So of course, extreme heat risks are also increased by the lack of access to healthcare and other critical services and gaps in official heat-related communication, such as early warning systems. And so to help us better understand how our communities can better address the heat risks to those folks experiencing homelessness, we're really excited to have Amy Schwabenlander, who's the Executive Director for the Human Services Campus in Phoenix, and Cliff Wade, the Outreach Specialist and Veterans Advocate at the City of Tucson. So Amy and Cliff, if you want to turn your cameras on and join me. Okay, Cliff, let's start with you, and we'll hopefully we can get Amy kind of situated with her webcam and everything. But Cliff, if you want to start us off, why don't you tell us a little bit about your role currently and your organization's efforts, just very generally in assisting people experiencing homelessness?
So I'm part of City of Tucson's homeless outreach team. We're actually go out in the deserts, the parks, the streets, the washes, wherever the homeless are, to work with them to help them get off the streets. We know that our homeless numbers have gone up, just like up in Maricopa County. We know that because of the numbers that we're seeing out there. My team actually engages with over 1,000 contacts every single year for people that are either homeless or at risk of homelessness or things like that. We try to get as many as possible into some type of housing option. Last year, we did our highest that we've ever done. During the pandemic, we housed 254 people in the 12-month period going from July 1 of the year before to June 31 this past year. So we're even going to try to go over and above that. We are using, the city has bought some hotels and shelters so that we can turn around and have places for the homeless to get them off the streets, to get them out of the heat. We're being very strategic about those that we're doing. We're cleaning up a lot of the large camps. We've got more shelters coming online. They're not quite there yet. Of course, we still don't have enough for everybody. So, cooling centers are always very, very important to us. But yeah, that's what my team does. We love what we do. That's where we're at.
Great. Thanks so much, Cliff. And Amy has joined us. So Amy, if you want to also just generally discuss your role and your organization's efforts in assisting people experiencing homelessness, and then we'll kind of dive into the heat-related questions next. Let's see, Amy, are you with us? I see that you're in the participant list.
Oh. Are you able to hear me?
Yep, we can hear you. Thank you.
Okay, so I was double muted. Thanks so much for the invitation and including the Human Services Campus in your session today. Happy to represent Maricopa County. For those who may not know, the Human Services Campus is located in Phoenix, just south of Jefferson, really between Phoenix City Hall and the state capitol, about 12th Avenue. We have over 13 acres of space. We're a collaboration of 16 organizations serving single adults experiencing homelessness. We typically see about 11,000 unduplicated individuals in any given year. We're also now seeing the highest unsheltered number that we've ever had in the neighborhood. While we're sheltering the most people ever, we have about 700 individuals sheltered every night, and we have another 1,000 unsheltered individuals just surrounding our Human Services Campus. So we all focus on a permanent housing placement for every person that comes here, have everything from 3 meals a day, shelter, healthcare, dental care, State Department of Economic Security, job services, behavioral health services, all co-located here to serve people as best as we can every day of the year.
Great, thank you, Amy. So Cliff, we'll go back to you. Can you, so we do have a very diverse audience with us today, and some are very closely aligned with, providing services to people experiencing homelessness. But for those that are a little bit less connected to that world, can you go through some of the challenges that particularly face people experiencing homelessness as it relates to extreme heat risk?
Well, we carry a lot of water. We carry a lot of other things to try to keep the folks at least hydrated. We don't have enough cooling sites for the homeless population that we have. And I think this is true everywhere. It's not just having a bunch of cooling sites, it's having them strategically placed where the homelessness are or within reasonable walking distance, because in the heat, they can't seem to walk as far as they can in the cold because the heat just gets to you that bad. Trying to get enough cooling supplies out there. We have organizations that go into the parks. We have organizations that go into the camps to bring out more water. I would venture to say we probably go through 3 or 4 pallets of water with my little 3-man team every single year. So that, and all of that is in the summer. We don't carry as much water with us in the winter. So, having the funding and the resources just to be able to do that little bit sometimes can be challenging to get. Of course, we always try to guide the people towards the cooling centers. We'll even transport them if we need to. But there are just so many out there that we're not able to help.
Yeah, thanks, Cliff. And Amy, I see you nodding in agreement quite a lot, but can you give us the Phoenix perspective and kind of what your perspective on that is?
Yeah, definitely agree with Cliff, everything that he said. I'm always amazed that people can survive a Phoenix summer living in a tent on a sidewalk. So the amount of heat, the difference in temperature is life-threatening. We also, of course, distribute lots of water. Every partner across the region, the Maricopa Association of Governments has a heat relief network in MAPS, respite areas, water cooling stations. And I think similarly in Maricopa County, as Cliff said, for Tucson, there really aren't enough of those places, as we've seen the population experiencing homelessness increase. In Maricopa County, we do not have a shelter bed for every person seeking one, which means we have a high number of unsheltered people really just trying to survive. In Phoenix, in Arizona, the heat is deadly. And so I think all of us working in this space, every outreach engagement team is doing whatever it can to provide those basic items that can help people stay hydrated, hopefully cool. One effect that, as I was listening to Cliff, I also thought about is medication storage. And it's a challenge every day of the year for people who use insulin. We have lots of requests for ice and thermos bottles and creative ways that people can keep things like insulin on them because there really aren't safe places for them to store such things. I think there's also, I'm trying not to read all the questions in the chat, but I saw a word that reminded me too. I think what heat also does is it triggers more of an emotional response. We tend to see more assertive, aggressive behavior, potentially more violence, really client on client in the unsheltered population.
Yeah, thank you so much, Amy. I see a lot of great questions coming into the chat, like you mentioned, but one more general question for me, and then we'll go into some of those more specific ones. So for a lot of the folks on this Zoom webinar, community members, decision makers. So what are the opportunities for communities across Arizona to better assist you both in assisting people experiencing homelessness as it relates to heat? And Cliff, let's start with you again, and then back over to Amy.
So, one of the biggest things that organizations can do to help is to open up their doors or what have you for a cooling site, to give people a place to get out of the 100+ degree weather, a place to get a bottle of water, a place to just lay down and cool down, get their body temperature down so that we can, so that they can survive. We have a lot of the cooling sites that we have down here in Tucson. Problem is they close their doors at 4 o'clock, and that's the hottest part of the day. So we need something with a few little bit more hours to it. We need something that is going to, that's really going to benefit. And we need it in the places in town that we have that don't have the cooling sites in their area. That'd be my best wish.
Yeah, Amy, how about you?
Yeah, absolutely. I think we have a similar experience at times, that the daytime respite centers are great. They're wonderful. They can provide, shaded areas, maybe air-conditioned space, again, access to water and maybe some services. And we don't necessarily have the same capacity overnight. There's a model that serves a substantial amount of people called iHelp, where the faith community and churches come together to open their spaces overnight. That might be one way that people on this call could look in their communities to find spaces similar to bring people indoors overnight. I think the health aspects have already been discussed or mentioned, and so having that place to be for sleeping and overnight is as important or more important as it is during the day.
Yeah, thank you, Amy. So a couple of the audience questions we'll get to now. Cliff, I think you might be able to take a stab at this one. So one of the participants is asking, are you able to determine the proportion of people experiencing homelessness that are also veterans? So if you want to.
Yeah, actually I am. I do a lot of work with the veterans. I can tell you down here in Tucson, our veterans homeless list is right around 250. The chronic numbers are down to about 87, I believe, which is a small part of our homeless community. The reason being is because we've been working on ending veterans homelessness for so long. At least the last 10 years, we've been really trying to focus on the veterans homelessness. So the percentages are little out of kilter because we haven't been working on the chronic as long. But yeah, and the veterans, the fortunate thing about it is we have a fantastic VA, and we can get those, if we can get those folks to the VA, they can get them into transitional if they have it or something like that, which is something we don't have for the regular homeless folks. So yeah, our veteran population is a lot lower than what our regular homeless population is.
Okay. And Amy, a question that you might be able to try to answer for us is, to what extent do behavioral health providers interact in coordination, and how aware are they or not aware are they regarding health vulnerabilities for people with substance abuse or mental health concerns? So kind of not heat specifically related, but kind of how all of those things compound each other.
Sure. There are several organizations that do regular street outreach and engagement across Maricopa County. Many of them share their information in the Homeless Management Information System, or HMIS, so that any other provider in HMIS can see that information. MAG also has a GIS mapping tool for the outreach teams, so that as an outreach team encounters a person, they can log on a map with a bit of background information on the individual as well, so that we can do some coordination of services and care. Like, there was a lot to that question. So, a lot of the outreach teams are behavioral health organizations that lead those teams, like a Community Bridges, CBI, the Human Services Campus. We have a multidisciplinary street outreach team that we continue to build, starting to serve this area right around us. And so it is about engaging people and giving them enough information and helping to build that trust in a relationship that when it comes time to offer them a shelter space or a housing option, they're more trusting of that information. Serious mental illness is obviously a component of the population that we serve. 40% of people who access services on the campus self-report that mental health is a barrier to housing stability. So having that coordination with our Regional Behavioral Health Authority, with Mercy Care, really working as much like a system as possible is critical so that we're doing stronger care coordination. But I would say that's definitely an area that could be improved upon, to have more of that sharing and working towards sharing data in real time.
Great, thank you. And a lot of the questions, of course, are centered around cooling centers. Not surprising because that's one of the more popular strategies for heat management. So lots of different questions around cooling centers, but to kind of summarize some of them, do you have a sense of how many people experiencing homelessness will go to shelters? And I guess, like, what are the barriers to that kind of prevent them from doing so? And how can we create more access to those places? Kind of sums up a couple of different questions that are there.
Well, one of the biggest things that any cooling center needs to do or to help do is these folks have pets, and most of your mainstream shelters do not allow pets. So these folks are out on the streets. They really have no place to go for relief because those that do accept pets are very, very limited. And these pets are what are the homeless family. They're part of the family. They'll feed the pet before they feed themselves, which is really, really great. But pets are definitely a huge barrier. Cooling centers themselves, just, they can be just a cool floor for somebody to lie down on to cool off. That's how easy it can be.
Amy, what are your thoughts?
Yeah, we often talk about people, possessions, and pets. And so if we want to really serve the population experiencing homelessness, they often have pets, and they often are keeping as much of their belongings as they can, because if you've lost your home, you want to keep your stuff. It may be all that you have. And so getting creative with storage solutions, with creating those pet options. Arizona Pet Project is growing, expanding their services to keep people and their pets together. So I think that's a new opportunity in our community, not necessarily heat related again. But when we think about this population, emotionally, mentally, it's great when we can keep people with the items that are important to them and their pets that are important to them.
Yeah, thank you, Amy. And of course, that consideration has a lot of implications for places that we kind of typically think of cooling centers, like potentially like libraries and other public spaces where bringing in pets and those items might be a little bit more difficult to do. So there's one question that, Amy, you might be able to answer. So this is the Phoenix. So the Phoenix City Council approved last year what's called a sprung structure. So if you could kind of describe what the sprung structure is and what the status of it is.
Sure. So we were fortunate. The city of Phoenix funded with American Rescue Plan dollars the purchase of a sprung structure, which is it's a relocatable structure. Ours looks rather permanent. It's connected to a concrete slab. It's at 9th Avenue in Jackson. We've named the program Respiro, which means respite, because we want to create a place where people can feel like they can take a breath and they can be inside and they can sleep. And so news flash, because we haven't gone super public, we started sleeping people inside Saturday night in small groups so we could test everything out. We have our temporary certificate of occupancy, working on some final things to get the city's final approval and permanent certificate of occupancy, and we'll be able to have up to 100 individuals in there for sleeping. And then as we can add staff, we want that space to be open to those same individuals during the day as well. And adjacent to that, the city of Phoenix also has funded a purchase of a toilet trailer, a mobile toilet trailer, and we have a hand washing station that Maricopa County had provided in the pandemic. And so that is now effectively opened as of Saturday morning to anyone in the public who wants to access those resources. We'll be adding potable water and shade in that area as well. So some of these incremental steps that we can take definitely help the population. And so also if anyone wants to learn more about that, we'd be happy to share our experience and the knowledge that we gained out of going through this sprung structure process. We think it's the first one being used as shelter here in Arizona.
Great, thank you, Amy. And for those interested in the whole cooling center conversation and how to better coordinate it, 2 of the breakout rooms, one will be focused on Central Arizona and one will be focused on Southern Arizona at the end of the workshop. So lots more opportunities to talk about how we can better serve all of our populations with cooling centers. I'm going to wrap up with one more question here, and then we may take our break a little bit early. So for heat mitigation, obviously things like urban forestry and increasing vegetation is one of the most popular strategies that cities are pursuing. So one of the questions is there a role for nature-based cooling strategies like increasing tree vegetation and shade canopy? And could that potentially help people experiencing homelessness, as cities are investing a lot of money kind of into their tree planting campaigns? So what's your take on trees and people experiencing homelessness?
Well, being that guy that goes out in the field and works with them in the heat of the day, yeah, shade's always nice. I'll take all of it I can get. And, when I look at the homeless camps, the majority of them that are all year round are somewhere in an area that's got some kind of shade, some kind of cover, not just for the cooling, but to help keep the folks hidden so that somebody's not calling them. The hardest thing to do is keep up with the homeless when folks in the community don't have the compassion to deal with them around their house. We've been trying to employ a little bit of a strategy during the COVID, because the COVID sat there and said, don't move the people. So we've been trying not to move them as much as we possibly can, unless they're causing issues. So yeah, I want some trees. I want some vegetation. I'll take any of it and all of it we can get. It's my answer.
Okay, Amy.
Yeah, I wholeheartedly agree. I mean, I think we're all human beings. We all know it's cooler where there's a shade canopy. We all feel like it's a healthier environment where there's some vegetation, and we face the similar challenges when we've had conversations about landscaping and trees for neighbors that are also impacted by homelessness, where there's trespassing, there's public urination, there's trash, right? Then we have to have some kind of consensus building around the balance of heat relief and helping people stay alive, up against what can then happen if people feel super comfortable and they don't want to leave an area. So it's an ongoing conversation, and certainly something that I think we should all keep talking about if we want to help people stay alive through summer in Arizona.
Great. Well, thank you both so much. A great conversation. And I know there were a couple of other questions, so we'll kind of keep an eye on those and see if we can answer them in the chat later on. But thank you, Cliff, and thank you, Amy.
So as we're welcome back, everyone. Pick up the second half here of our workshop. So I will be passing over to a couple of our colleagues here, Melissa Guardaro from ASU and Dave Hondula, City of Phoenix, also ASU. We'll be facilitating a little bit of discussion here about financial tools for heat management. A couple of our folks that have been entering discussions a little bit with Swiss Re, Serena Sowers, and Yami Chu will be participating in that discussion. So at this point, I would just pass it off to Melissa and Dave.
Thank you so much. Is Dave on and back? Well, welcome back. We're going to talk about some different tools in the toolbox that we normally do not consider when we're talking about extreme heat mitigation and adaptation. So I'd like to give a shout out to Dr. Patricia Solis, who was the one who initiated this conversation with Swiss Re and has been orchestrating a lot of the work that's going on behind the scenes. Dave Hondula, most of you know from the City of Phoenix and also from ASU. Serena Sowers is a Vice President of Public Sector Solutions of North America for Swiss Re, and she focuses on creating insurance-based solutions to large global challenges. Yami Chu is a senior product manager with the same sector, public sector solutions. And she also works with federal, state, and local governments to assess risk exposure and to design risk transfer solutions. So we're going to talk a lot about reinsurance, and I know that's something that's probably not top of mind for a lot of people, but reinsurance is really a way of protecting from really high claims, and it spreads the risk. So if you were to think of your own personal situation, you can have auto insurance, and you can have life insurance, and you can have homeowners insurance. But if you were to have umbrella insurance, that also spreads the risk around and reduces liability. So in a nutshell, I'm sure that Serena and Yami probably have a much better description of what reinsurance is, but they do that for municipalities. We are going to have 2 waterfall exercises, so get your keyboards ready. And for those of you that have not done waterfall exercises, we're going to post a question, and then you put in your answer, but you wait to hit enter so that everybody is contributing at the same time. And we're looking for a full participation. I know that there's over 200 of us in the room, so even if you have no idea how to answer that question, just putting it in the chat box, no clue, or I don't know, will be helpful for the rest of the presentation as well. So for reinsurance, as I said, part of the issue is to reduce the financial shocks associated with heat events or unusually hot seasons. And you also want to make sure that you're increasing the capacity of the community. And you'll see later on when Yami and Serena go through their slide, it's an interesting way of financing some of our mitigation and adaptation solutions. But this is not free money. I mean, these are insurance products that are purchased. And Dave Hondula, maybe you can help from the City of Phoenix viewpoint, but you know, heat is very expensive. We have talked about the cost of heat from a health standpoint. The Nature Conservancy is also going to go through their report about some of the economic assessment of heat in the Phoenix area. And then we also have all sorts of other costs that you don't necessarily directly associate with heat, but certainly that's part of the issue. And this is labor productivity, road infrastructure, energy demand. We think about trees, we want to plant trees, but you know, trees also end up dying along the way as well. When you think about who would actually benefit from a reinsurance project, we have the MAG Heat Relief Network, and I know Kelly Dunley is on the call right now. And when you think about who would fund the Heat Relief Network, especially if we were to have extended periods of extreme heat, this would be one way to help. And then also we have our faith-based cooling centers and hydration stations that really, this isn't necessarily their mission, and this would help to fund that as well. And also assist in philanthropy along the way. And also this would be local governments purchasing contracts to help cover those costs. So even though the Faith Network is providing cooling centers, the cities would reimburse them for things that would be considered city responsibility, if you will. Okay, so now we have the first waterfall. Next slide, please. So what are the extra difficult to manage costs that your organization incurs, particularly during the hot summer periods? And please answer this from your perspective. So if you work for a city, that could be extra days off, or if you work for a not-for-profit, it could be decreased productivity. So we're going to give you just about 30 seconds to type your answer in. We're going to, and this is during extreme events. This isn't just normal times, but this is during extreme events. So, you know, we're anticipating, let's say, an extreme heat warning days in June, but what if that lasts 3 weeks along the way? So you can see that some of these answers are about things, you know, trees dying, need more water, and some of these are also about productivity along the way. So there's a range of options of things that we could actually cover for a reinsurance product. When you think about some of these heat risks as well, what types of organizations incur significant operational and financial shocks during particularly hot summer periods? So we're not just talking about our normal summer, particularly in Maricopa from May through September. We're talking during extreme heat events. Who do you think is impacted here? And again, we're going to do the waterfall. So type your answer in, but don't hit send just quite yet. So I see we have a lot of answers from before. I'm hoping that Serena and Yami and Dave could read through them as quickly as they are coming in. Absolutely. Hospitals, outdoor workers, libraries, energy providers, yes. Power generation, absolutely as well. So I'm going to turn this over to Yami and Serena to discuss some of their thinking behind what could be covered underneath reinsurance for extreme heat events. And once again, this isn't just for your normal extreme heat, but this is for extended extreme heat events.
Melissa, thank you so much. I really appreciate this time and really hearing everyone share the many different perspectives, and also just reading quickly through the chat responses. I mean, it really is impressive the kind of impact extreme heat can have in the larger ecosystem that we're all part of. So to that extent, I think Melissa's description of insurance and reinsurance, if we can go to the next slide. Oh, Melissa, I think we had one more waterfall.
You know what? I realized that we skipped this waterfall.
Why don't I give it right back to you?
Would you mind just taking a step back?
Yeah.
Sorry about that. So if you had the financial flexibility to do so, and I love that, you know, if costs were no issue there, what additional resources would your organization deploy, particularly during hot summer periods? So by way of example, and this is a waterfall as well. So by way of example, we heard about cooling centers perhaps being open after 4 or 5 o'clock into the early evening. But for your organization, what would you do if money were no object? This should be a good one, Serena. Okay, hit send. People are already hitting send. I like the resiliency centers, resiliency hubs, additional water, extra pay, water bottle filling stations, cooled walkways. And again, we seem to run the gamut between things and extra services along the way. Cooling centers for kids, that's something that we will cover in the cooling center breakouts, the cooling centers that are targeted towards family activities. Energy efficiency, yes, that all leads into making your life more thermally comfortable. Affordable energy efficiency too. Okay, in the interest of time, sorry, Serena, that I jumped the gun there with the introduction, but if you could go back to your presentation, that would be great.
No, I'm really glad we had the third waterfall, and just reading through some of these responses, this really resonates. All right, so from an insurance reinsurance perspective, from an average person's perspective, when we think about insurance, we think about an event happens, you have losses, and then based on the losses, you might be reimbursed for the expenses that you've incurred because of the shock or stress that you've experienced. So typically we think of either damage to your home, damage to your car, that type of physical impact to you, to your business, to the municipality. But just reading through the responses for Waterfall 3, what really stands out is a lot of those expenses that we are highlighting don't fit into the typical type of physical losses that a community experiences. It's about overtime costs. It's about the excess utility costs. These are the type of things that you experience. So if we can go to the next slide, when we think about kind of a catastrophic event that happens, what you typically see is there are lots of expenses that incur even before the event happens. During the event, there are expenses, and after the event, there are significant amount of expenses that come up throughout the experience of an extreme heat event. So before an extreme heat event, you might have expenses around communications, getting information out, getting the right type of responders available to identify at-risk people. A lot of the individuals that we heard from today can speak to it, because in preparation of some of these extreme events, you have these expenses that pile up. And during an event, you have that need to get the right type of rescue workers available, to provide temporary housing, to have transportation available, etc. That also costs money. But after an event, you also have these expenses where you are talking about How do you fix infrastructure? How do you pay for the workers' comp claims that come in, the unemployment expenses that come up, or lost business tax revenues? So this, for us, is the full breadth of the type of expenses a community might experience. And the challenge that we, Yami and I kind of posed ourselves and the people that we work with is, how do we use insurance as a tool to reduce the impact of extreme heat event and allow for insurance to be a financing tool to make funding available during an event, so that you're not waiting for weeks, months, et cetera, to indemnify for an event, but actually using insurance as a financing tool to reduce. So to that extent, could we use insurance to reduce health impacts, to reduce deaths, to figure out how that funding can be available so that the right type of individuals are available? So to that extent, we have had a lot of innovation over the last many years, specifically around the type of insurance that's available, specifically parametric insurance, which is essentially an event-based trigger. So instead of you suffering a specific physical loss to be reimbursed by an insurance company, it's if an event happens, we know and we trust that a government entity has suffered loss. So we make funding available quickly and provide flexibility around how you can use it, and give the kind of funding that can be available in a manner that can be used as the government entity finds to be valuable, right? Because you don't know what type of expenses are going to come up after a disaster. So to that extent, we don't want the insurance to only pay for specific type of expenses, but for a full breadth of expenses. So with that, why don't I turn it over to Yami, who can walk us through a little bit of how we see parametric insurance being valuable and useful.
Thank you, Serena. And I think where I might take a step back and why we use the language of parametric versus indemnity, which Serena used, is that we have enough evidence out there that there is going to be an extreme heat event. And with that event comes cost, right? We have known that you people in Arizona have lived through it year to year. So we know that every summer there is a set amount of budget that has to be allocated to handle extreme heat conditions in Arizona. And so what the parametric idea with insurance is to say that, could we reduce that burden of costs? And insurance is a tool where we can think about within that budget that you have to utilize to actually reduce the heat health business impact that you might be seeing around an extreme heat event. Could we build resiliency within the community, as well as from a financial or budget sense, maintain a sustainability in that budget, right? Stretch that dollar a little bit more with an insurance solution. And examples of this could be, say, you have determined a extreme heat event that could be, triggered, where we did an as if scenario where, we picked 118-degree day as, the day that triggers, that says, ooh, if there's a 118 day, we know that means that we have to scale certain resources. We're going to see greater impacts across the energy grid. We're going to see greater impact when it comes to hospitals and the increase in services that we need from firefighters working extended hours, or healthcare workers in clinics or hospitals, recognizing that they might see a surge of people who going through some acute condition that they need to seek care. And so what insurance can do is utilize that money, if that event were to happen, to potentially, subsidize, energy expense for vulnerable populations, right? And so these could be the low income population where you go, if they had the money, they could turn on the AC all night. Could we help support them financially? Could we also think about using that extra money that gets released when that extreme heat event happens to fund nurses, that cooling centers, or in their case, could we start using that money to think about how do we make some of these cooling centers more pet friendly, right? Would having an extra money help expand the number of cooling centers that allow pets to go in? And and what costs does that actually take? Other things to think about is to say, could we use that money to what we say fix infrastructure damaged by extreme heat? But that is, I think it was Rhonda who earlier mentioned, what if the AC is broken, right? How can we help support fixing that? And that is the fixed infrastructure when it comes to maintenance of technology that we know that if vulnerable populations had access to, maybe could reduce their overall health burden when it comes to an extreme heat event. And so that is when we're thinking about, well, how we define a event and how some of the examples of extra money could be utilized in a community.
So to that extent, a few public policy measures that we were considering is if there is an event that is experienced, let's say 3 days of 118-degree weather, we have funding available for special type of public policy programs to be funded. These are just examples that we had brainstormed with various folks on the call, but really thinking about, could there be a subsidy to utilities that the insurance payment can fund that allows for vulnerable populations to be supported? Or could there be nurses available in resilience hubs and cooling centers to catch these type of heat impacts earlier on in the process, and other types of infrastructure damages that might be experienced. So to this extent, we really see this insurance payment as a way for the government entities to provide additional support for the communities to respond. So you really have a preventative solution in place, not perhaps preventative in the mitigation sense, but preventative in the context of reducing the full impact of the extreme heat. So really you kind of reduce some of the long-term impacts that Julie had presented earlier on in the presentation with some of these public policy measures. With that, we are happy to take any questions that you might have.
Thank you so much. There were a couple of comments and questions in the chat. The first comes from Rick McCallum. And this is probably the elephant in the room, Serena and Yami. Insurance is a profit-driven company, and how does this benefit all these different stakeholders that are here?
No, Rick, that's a great question. So insurance companies, yes, we are profit driven. We are a business, so I will not take that away from the conversation by any means. But the value insurance provides is to reduce volatility. So if your government budgets, let's say, I'm going to make up a ridiculous number, but $100 for extreme heat per year, but you have more extreme heat events than you had planned for. So that $100 should have paid for 3 extreme heat events. And now we're talking about 5 extreme heat events. Insurance can play a role in preparing for that. So instead of having to shut down those institutions that provide critical services for those extra 2 events, insurance can come to support that additional kind of volatility. So by no means, Rick, would I pretend to say we are here in a nonprofit capacity, but the value that a public-private partnership can create is to figure out how you can bring money from the private sector to reduce some of these volatilities. And to this extent, we work with a number of government entities across the US and globally to provide those type of services. So Rick, I'm not going to deny what you're saying, but I think the question is how can we work together to bring private sector money to the conversation?
I think that there's also this issue of the wrong purse problem, that a lot of the costs that we see associated with heat, like healthcare costs and the impact to the unhoused populations, how does this all work together in these kind of products? So these are basically municipal products, am I right?
These can be used by businesses, but we fine-tune them specifically for governments, right? So what we have seen this product be valuable is from third world countries to US states, we have them purchasing it for various types of things, right? So if your budget may not accommodate overtime expenses for first responders, this could be used to respond to that. right? If your budget did not plan for, these extra events that you hadn't planned for, this could be used for that. Or if your budget is lacking in some of the excess funds that you would need to provide support for vulnerable populations, we have a lot of clients who use it to refill the pot of funds that is available to support vulnerable populations. So the question really here is, how can this type of financing be available to support really truly catastrophic events that you didn't budget for, that you didn't anticipate for, or you ran out of funding for, right? So you have a different type of financing tool here.
Okay, excellent. We also had a comment in the chat, and I think that a lot of people are thinking about how vulnerable our electricity grids are in extreme temperatures. And the comment from Barbara Warren was having generators to keep our cooling centers up and running, but I think that that goes even more. How would this product work in helping keep people safe? So the reference was to what happened in Texas during Snowmageddon. How would this product work in that situation?
Yeah, I mean, did you?
Yeah, I can try to take a stab at that. I think in terms, if we look at the Texas situation, it is almost a two-lens approach. First is in that anatomy of a disaster particular slide that Serena and shared previously, there is sort of this anticipatory, what can we do before there is an extreme heat event, or in the sense of when it comes to, we know of weather damage onto a utility system or a grid system happens every year, especially after a long hot summer. Could we do something where we look from a maintenance standpoint to make sure that we check to see any maintenance needs to be done in an energy grid or water utility system before the coming summer? So that's one way having this type of financing could help support, if that's not already part of that planning in advance thinking. Alternatively is during an event, there is going to be an increased demand in energy, and when that comes, there's price changes and fluctuations. And so an insurance solution potentially could reduce almost the sticker shock that people might see when you trade energy on a spot market, right? And so it becomes financially still feasible to offer the utility and energy subsidy to low-income families, even though there might be some energy that's traded on or purchased on the spot market that needs to during an extreme heat event. So that is another utilization of this type of product and protection that it can be offered. So there is that maintenance aspect, and then there's actually the volatility of the cost of the energy being traded on that market on that day when you actually need all of the ACs up and running.
I see, it's like flattening out the costs.
Yes.
We had that for gasoline right now, but that's another topic entirely.
That's another topic.
Well, thank you very much. And I'm sure that you're going to stick around for later on in case people have more questions, and I'll hand it back to Dave and Led.
Thank you, Melissa. If we could go to the next slide. Great. Yeah, that's a really, I've attended a lot of virtual workshops, as I know you have, and that's a really high number. So it's good to see that so many people have remained engaged throughout both breakout rooms. I know our last one went a lot faster than the first one. So but Paul, let's close out the workshop. I definitely wanted to thank all the organizers. So again, Arizona State University, Arizona Department of Health Services, NOAA, the University of Arizona, and all of our speakers and facilitators for the breakout rooms for their help with this event. Paul?
Yeah, just a lot of good work. And thank you everyone for attending our 6th annual workshop. So hopefully folks found at least one good piece of information, and hopefully more than that, but something good that you can take tangible with you as your organization, as you start to get ready for our next heat season. Because as we know, this is Arizona, it's going to be very hot, sometimes brutally hot at times, and unfortunately we continue to see these significant heat impacts that occur. So we did, as it was mentioned, record the first part of the session, and we've been capturing some of the questions and whatnot that have been coming in there. So the organizers will take some time to parse through that stuff, and we'll be sharing slides and additional information out with you in the next few weeks. And I would just give another plug for the NIHIS workshop as well that was going to be coming up for the next 3 days that's available. So Lad, if you had any additional parting comments, or if we are good to call our 6th annual heat workshop a day.
Yeah, no, I just wanted to thank you, Paul, and our colleagues at Arizona State University for kind of giving Tucson a larger role this year, and excited to see this, see the workshop grow to include the whole state. So that's been a really positive move, and hopefully we can continue to include all of those other counties that aren't currently represented yet. But I did put the link to the NIHIS national meeting in the chat, so folks can check that out as well.
Yeah, that's a good point. I mean, the critique always of being too Phoenix centric is omnipresent in all of our lives, for no matter what it is, whether it's heat or anything else. So yes, we're always very happy if we pull in additional colleagues from across the state to look at this topic. So thank you guys for joining in and making your presence really felt this year. So
thank you.
Yeah, so I think at this point, we'll close the workshop, and thank you everyone for attending, and we'll be sharing information out in the next few weeks. So enjoy the rest of your week.